Welcome to The Explainer. Today, we're going to build the mental model that separates a nurse who just goes through the motions from one who truly leads patient care. We're breaking down the absolute core skills: delegation, supervision, and of course, prioritization.
Okay, let's just dive right in with a classic NCLEX style question, right? You've got 4 patients. They all need you at the same time. Who do you run to first? I know, it feels overwhelming, but trust me, by the end of this, you'll know the answer without even thinking about it.
So how do we answer that question correctly? Well, we can't rely on guesswork. We need a system, a framework. So we're going to build the clinical leaders pyramid together. And that foundation, the part that holds everything up, is the one thing you can never, ever give away: accountability. Now, here's the crucial difference. Responsibility is the what. It's the task itself, like getting a set of vitals. You can absolutely delegate that responsibility. But accountability, that's the so what. You are always, ultimately, answerable for the outcome. If those vitals are abnormal and nothing happens, that accountability, it lands right back on you, the RN. This is the golden rule. You got to tattoo this on your brain. You delegate tasks, not patients. The second you delegate something, you're not just washing your hands of the situation. You're using your team to get things done, to gather data that you will ultimately analyze. That patient is always yours. Okay, so our foundation of accountability is solid. Let's build the next layer of the pyramid. You've got a dozen things to do. How in the world do you decide what matters most right now? You need a reliable system for prioritization. Think about it like a funnel. All your patients' needs go in at the top, the third-level problems. Things like discharge teaching. Yeah, they're important, but they're not right now important. Then you've got second-level problems, like sudden pain or confusion, and these are definitely getting your attention. But everything filters down to the point of the funnel, the first-level problems. These are the issues that could harm or kill your patient right now.
And this right here is your absolute, non-negotiable first-level filter. Before you even think about anything else, you have to ask, is there an immediate threat to the patient's airway, their breathing, or their circulation? Are there any vitals or labs that are screaming danger? This ABC framework is the first screen you have to apply to every single decision you make.
Okay, so you've prioritized, but you can't be in 4 places at once. This is where you have to use your team by delegating. So let's add the next layer to our pyramid. See, safe delegation isn't just some vague idea. It's a strict protocol.
This is your 5-point safety check. Every single time you ask someone to do something, you have to mentally run through this list. Is this the right task for them? Is the patient in the right circumstance, meaning are they stable? Is this the right person for the job? Did I give the right directions? Were they super clear? And finally, did I provide the right supervision and follow-up? If you get a no on any of these, that task stays with you, period. Now this slide is where the rubber meets the road. It clearly maps out the right task and right person. So your AP or tech, they can absolutely get vitals on a stable patient. But an assessment? No way. An LPN can give most meds and do wound care, but they can't do that initial admission assessment. And you, the RN, you have to hold on to anything that requires clinical judgment, patient teaching, or caring for anyone who is unstable. Knowing these lines isn't just important, it's pure NCLEX gold, and it's essential for keeping patients safe.
All right, we've got our delegation rules down, and now we're at the very peak of our pyramid. This last piece is the safety net that holds the whole thing together. Clear, standardized communication. Because what good is all your great clinical judgment if you can't communicate it effectively to your team, right?
So when you need to call a doctor or give a report, you don't just ramble. You use SBAR. Think of it like a script that cuts right through the noise. S is for situation. What's happening right now? B for background. What's the context? A for assessment. What do you think is going on? And R for recommendation. What do you need? This simple format makes sure nothing critical gets lost in translation. And what if you see something that needs to stop right now? That's when you use the CUS tool. It's standardized language that ramps up the urgency in a professional way. Starting with "I am concerned" is a polite heads up. "I am uncomfortable" raises the alarm. And when you say "this is a safety issue," well, that's like pulling the emergency brake. Everything stops. It's a powerful tool that protects your patient and your license.
Okay, let's bring it all home. We've built our pyramid from the ground up, moving from our own personal responsibility all the way up to team leadership. Let's recap how this framework gets you ready for your exams and, more importantly, for the floor.
And here it is, the clinical leaders pyramid. It all starts with that solid foundation. You are always accountable. Building on that, you prioritize using your ABCs. From there, you safely delegate using the 5 rights. And you hold it all together at the top with clear communication tools like SBAR and CUS.
These are the high-yield takeaways you absolutely have to know. So let's go back to our question from the beginning. Remember those 4 patients? Patient A needed teaching, that can wait. Patient B had pain, super important but not life-threatening. Patient C was confused, also a big safety risk, but what about patient D? A respiratory rate of 32. That is a B, breathing problem. It is a first-level life-threatening priority. ABCs always, always win. The answer is and always will be D.
And that's really the whole point. This pyramid isn't just some trick to pass an exam. It's a mental model for true clinical leadership. It's the framework you'll use on every single shift to coordinate care, protect your patients, and lead your team. So the real question isn't just if you know the pyramid, it's how you'll choose to use it. Will you be a task doer, or will you be a care leader?